In this video, we are going to break down and compartmentalize the nerves, arteries, veins, and muscles in the leg. So let's get into it. For this video, I'm using one of the free downloadable outline drawings that are always available to you through the link in the video description if you want to follow along. First, let's orient to where we are. We can see a small portion of the anterior thigh, the knee, the lateral and anterior leg, the ankle and dorsal foot, reminding ourselves that the leg is the area inferior to the knee and superior to the ankle. On the posterior surface, we can see the distal posterior thigh, popliteal fossa, which is really just the back of the knee, the posterior leg, ankle, and I have a separate plantar foot so we can relate structures to the foot. So that's our setup to organize the leg into three compartments. The posterior compartment consists of the entire posterior leg. Then anteriorly we have two compartments, the lateral compartment over the fibula and the anterior compartment between the fibula laterally and the tibia medially. Most of the anterior surface medially is actually taken up by the tibia that you can palpate or feel, and we typically refer to as our shin bone. Now let's talk about the nerves that exist in these compartments, where they came from, what they're doing there. The nerves in the leg in all compartments primarily originate from the sciatic nerve. Starting on the posterior surface, we can see the common fibular branching from the posterior thigh and leaving our picture laterally just above the knee. We can also see tibial, the other branch of sciatic nerve, remaining on the posterior surface, traveling through the popliteal fossa and the posterior leg to wrap around the inferior aspect of the medial malleolus. But where did common fibular go? Common fibular ends up in the anterior surface near the head of the fibula and immediately splits into two branches. It was common, and now it's getting more specific. One branch is called deep fibular and ends up in the anterior compartment and gets its name from running deep in between the muscles of the anterior leg and then diving deep into the foot to suddenly reappear in the first web space. The first web space is an area of skin between your big toe and your second toe. I like to refer to this nerve as the flip-flop nerve because when you wear thong-style flip-flops, the part that touches in between your toes is innervated by the deep fibular nerve. The other branch off common fibular is a nerve called superficial fibular, which is named superficial because of how superficial it becomes in the lateral leg. It will innervate the fibularis muscles, then poke through the crural fascia that surrounds the leg, crura means leg, to run superficially over the majority of the dorsum of the foot, providing that area with skin innervation. The tibial nerve that disappeared around the medial malleolus, the medial bony bump of your ankle, is actually headed for the plantar foot. It travels through a space just inferior to the medial malleolus called the tarsal tunnel to enter the plantar foot and split into medial and lateral plantar nerves. These nerves provide muscle and skin innervation to the plantar foot. There are three other nerves that are relevant to us in the leg, and all of them are going to innervate skin. Therefore, they are all cutaneous nerves. The first is a very long branch of femoral nerve that pokes through the sartorius muscle and then descends down the medial leg onto the medial aspect of the dorsal foot, providing skin with innervation in these areas. The other two nerves I want to mention are on the posterior surface and are branches from the tibial and common fibular nerves. Tibial nerve gives off a medial sural branch that combines with a lateral sural branch from the common fibular nerve. Lateral sural will branch into the skin of the lateral leg and provide it with innervation, while the combination of lateral and medial sural will run in the subcutaneous tissue of the posterior leg and be called the sural nerve. Sural nerve is the nerve that runs with the small saphenous vein. Next, we cover arteries. The femoral artery, not pictured here, runs through the adductor canal in the anterior thigh to then dive to the posterior surface through the adductor hiatus and change its name to the popliteal artery in the popliteal fossa. The popliteal fossa is really just the back of the knee, and the knee needs blood too. Geniculate arteries branch from the popliteal artery to create an anastomosis around the knee joint. They are named for where they are in relation to the knee. While they are very deep, it is much easier to find the superior geniculate branches in the lab. The inferiors are covered by your posterior leg muscles, so do look for two branches superior coming off of your popliteal artery, very, very close to the bone. Almost immediately upon entering the posterior leg, the anterior tibial artery will branch away and disappear from the posterior surface because it, like its name suggests, is heading to the anterior compartment to supply the anterior leg muscles with blood. Laterally, we'll see another branch come off a little farther down called the fibular artery that is headed to the fibular or lateral compartment to supply those muscles. Both the anterior and fibular arteries are going to come off the posterior tibial artery, which will also wrap around the medial malleolus just like our tibial nerve did. You could consider posterior tibial the continuation of popliteal artery, and posterior tibial, just like tibial nerve, will end up in the plantar surface of the foot to provide it with blood as a medial and lateral plantar artery. On the anterior surface, we can look at what happens to the anterior tibial artery as it descends onto the dorsum of the foot. The medial and lateral malleolar arteries will branch off at the ankle, and this marks the point at which we start to call the anterior tibial artery something else. Once it is on top of the foot, we call this artery the dorsalis pedis artery, or pedis artery, which translates literally into dorsal foot artery. Dorsalis pedis will give off two arteries. The first is called the arcuate, and it remains on the dorsal surface to arch and have branches to the digits, which are not pictured in this image, and then we'll give off a branch that dives to connect to the lateral plantar artery on the plantar surface, called the deep plantar arch. And that is all our arteries in this area. Very quickly, we will discuss some superficial veins. To guarantee we understand their drainage patterns, I'm bringing up a full lower limb picture and adding in some deep veins like the femoral vein, which runs with the femoral artery in the anterior thigh and has a very long superficial cutaneous vein that drains into it. This vein is called the great saphenous vein, and it will begin on the dorsum of the foot medially and go all the way up the medial leg to the medial thigh and then drain into the proximal portion of the femoral vein. Just like the femoral artery, the femoral vein travels through the adductor hiatus to become the popliteal vein, and it is here that another cutaneous vein is going to drain. This vein is called the small saphenous vein, and it will drain the dorsum of the foot laterally and then go up the posterior leg into the popliteal vein, thus completing this dorsal venous arch where the great and the small saphenous veins connect. These cutaneous superficial veins should be organized and grouped with some of the cutaneous nerves we discussed earlier as they travel together. The saphenous branch, the femoral nerve, will run with the great saphenous vein, and the small saphenous vein will run with the sural nerve on the posterior leg. Relationships are always important. Now let's look at the muscles of the leg. Keeping with the compartments we developed earlier, the lateral compartment, which could be considered the fibular or peroneal compartment, consists of muscles with fibular in the name, fibularis longus and fibularis brevis. These are both everters of the foot. While these muscles also weakly plantar flex, their main action is eversion. The reason I emphasize that is because in the case of an injury, loss of eversion would point towards a fibular compartment or superficial fibular nerve issue, whereas loss of plantar flexion really doesn't indicate a lateral compartment problem, but probably more likely a posterior compartment problem. We are really concerned mainly with the primary action of these different muscles. Secondary is important, but let's first focus on primary since it is much more clinically relevant to us. The anterior compartment could be called the extensor or dorsiflexor compartment, as its muscles are primarily dorsiflexors of the ankle and extensors of the toes. These include the tibialis anterior, extensor digitorum longus, and extensor hallucis longus, all of which dorsiflex. The tibialis anterior also inverts the foot, and the extensors also extend the digits, the specific digits determined by their name. A loss of deep fibular nerve would create a real issue when walking, as you would not be able to pick up your foot when taking a step forward, and this would cause your foot to drag on the ground. This is referred to as foot drop. Foot drop is most commonly actually a common fibular nerve injury, as it affects both the superficial fibular nerve and the deep fibular nerve. Because the common fibular nerve is close to a bone, the fibula, and therefore at risk of injury if something happens to that part of the bone, because it goes right on top of the head of the fibula, foot drop is thus typically involving both loss of eversion and dorsiflexion. Eversion and dorsiflexion are essential to a normal gait pattern. When common fibular nerve is injured, a patient will present with what's called a steppage gait, where they use their thigh muscles and hip muscles to lift their whole lower half of the limb higher so it can clear the ground as they walk. Or they will have a very distinct foot slap when they are walking, as they cannot control the movement of lowering their foot from a dorsiflex position to a neutral position anymore. But enough about foot drop. Posterior compartment could also be considered the plantar flexion or flexion compartment. These are the muscles that help you jump and stand on your tiptoes. They are organized into two groups, a superficial and a deep. The superficial includes the gastrocnemius, soleus, and plantaris muscles, and the deep includes the flexor digitorum longus, flexor hallucis longus, and the tibialis posterior. Like I said, most of these muscles will plantar flex the foot at the ankle, and the muscles with flexor in the name will also flex the digits in their different ways. Tibialis posterior, like anterior, will also aid in inversion of the foot. So now we put it all together. Lateral compartment, aka the fibular compartment, innervated by superficial fibular nerve, supplied by fibular artery, full of fibularis muscles, everting the foot at the ankle. Anterior compartment, innervated by deep fibular nerve, supplied by anterior tibial artery, containing extensors and dorsiflexors, and you list them as you learn them. Two things of note about the anterior compartment. There is a muscle that is not found in every individual called the fibularis tertius. I refer to it as the fibularis thirtius because it's the third fibular muscle when it exists. And weirdly, it is not found in the lateral compartment, but in the anterior compartment instead. Typically blended with the extensor digitorum longus, but not always, you will see an extra tendon going to the base of the fifth metatarsal, and that is the fibularis tertius. It will, in fact, also help to evert the foot, just like the other fibular muscles. Second, the deep fibular nerve will also innervate two dorsal foot muscles that are the brevis versions of the extensor digitorum and hallucis longus. And that's all I needed to say about that. Finally, the posterior compartment, tibial nerve, posterior tibial artery, and the plantar flexors of the digits that I would list as I learn. Also of note, the small saphenous vein and the sural nerve would be found in this area. Now, I know these outlines don't work for everyone, but this material specifically, the innervation and the blood supply of these three compartments, are commonly confused. So let's simplify this even further with boxes instead of leg outlines. Lateral compartment, fibular, superficial fibular nerve, fibular artery. Anterior compartment, this is the one everybody starts jumbling words in, is deep fibular nerve, but anterior tibial artery. Deep fat is a way to remember this. Deep stands for deep. F is for fibular, A is for anterior, both the compartment and the first half of the name of the artery, which is anterior tibial. So T is for tibial, deep F-A-T. This works for some people, but come up with your own if it doesn't work for you. Finally, posterior compartment, tibial, it's posterior, so it's tibial nerve and posterior tibial artery. Hopefully this helped you organize the leg. Next up is the layers of the plantar foot. As always, thanks for watching. Like and subscribe to the channel. Don't forget to use those downloadable drawings and let me know what you want to see next in the comments. See you later.